economic growth all the way from 2012. We were only our trajectory was just disrupted by COVID-19, but we've been doing very well. So that, in terms of positioning the health sector, we actually look into how it can contribute to the economic growth. In terms of the political pillar, we aim to have an issue-based, people-centered and result-oriented and accountable democratic political system. And you may wonder how the health sector and health issues also interlink with politics. It is very critical because the political system that you have in the country and the political goodwill will also govern how those people who are already in government adopt and conceptualize the agenda on health. For example, we now have a very good example that the political system for the last 10 years, we are having an election in August, has been very pivotal in terms of promoting healthcare because of the Big Four agenda that the president identified in his manifesto. So then we have the social pillar, where the health issues actually are grounded, because on the social pillar, the vision seeks to build a just, cohesive society, enjoying equitable social development in a clean and secure environment. And health, as I say, is one of the sectors under this social pillar to ensure that we have a healthy and productive population. So the specific goal of the health sector is to ensure equitable, and I've had a lot of conversation on the equitability of our health care. We are still not yet there. We cannot declare that we have an equitable health system. On the second one, it's supposed to be affordable. Again, it is not clear. It is not yet 100% easy for us to say that we have an affordable healthcare. You've had the statistics that we had hoped that the 5 million Kenyans who are below would then be given universal health access, and we were only able to attain to 1 million. So we have work to do, so we still haven't attained the affordability goal. In terms of quality health and highest standard, again, this is a journey in progress. It might not really be extremely attainable, but there are levels where we can attain it, and we feel that we have sufficiently moved, for which we have made strides, and major strides for that matter. And we hope that going forward, we will be able to also discuss in the main discussion, maybe through a brainstorm as well, devise new ways of helping in terms of improving the quality health and bringing in the health standards to the highest levels. So we needed to increase access to quality healthcare services through social health protection for the more vulnerable to access healthcare. And in this, I think if you recall where Kenya was in around 2010, now we're in 2022, if you look back a decade ago, in terms of access to healthcare, we have again made very significant strides. The number of health centers that were available and the local reach, the distance between an individual's home and the place where they would go to seek medical health has greatly reduced. We have now an increased number of health centers, and I believe the Kenya Health Forum entity stated that yesterday. We have more dispensaries, and we have localized healthcare to the lowest level. We are still not able to meet the 8-kilometer distance that was highlighted in the vision, but we have made strides. The goal of the vision initially was to ensure that Kenya restructured the health delivery system and shift the emphasis from promotive care to lower the nation's disease burden. I think on this goal, we have made strides because we have now opened up. A lot of changes have happened. We have now very well-grounded private sector health providers in place. There is not 100% reliance on government health provision. And again, with devolution, now that health was a devolved entity, we have also seen investors investing in the counties. So we have moved forward in that direction. In terms of UHC, Having it been outlined, and I think Ms. Gitao mentioned it, it was an initiative by the president with a particular focus on reducing the cost and having healthcare being affordable. We have made a lot of strides, and in terms of that one, I think we have case studies which we are able to now cite and say that in the next preceding years, as we go to the medium-term plan 4, we will be able to fast track with the best practices that we have gotten from the SDGs, from the Big Four, from the UHC. I don't want to mention about the SDG goal number 3 because it's all that we are discussing here. But I want to say that we have also made strides in terms of access to health insurance for all citizens. We have access to fully equipped health centers. We have established 10 new referral hospitals. We have the centralized Kenyatta National Hospital. You are aware of the new hospital at Othaya. It was Othaya National Hospital. It was a specific branch of Kenyatta National Hospital. It's a level 6, and it was renamed Mwai Kibaki recently. And we have also increased the number of mobile health facilities available. I want to give you a slide on the Vision Health Sector flagship programs and projects, because this is the thematic issue of this thematic line of highlighting new investments. We have 6 thematic issues. We have the Social Health Protection Program, we have the Medical Tourism Program, we have the Health Infrastructure Program, we have Community High Impact Interventions Projects, we have the Digital Health Programs, we have Human Resource for Health Program, Quality of Care, Patients and Health Workers Safety Program. So on those themes, investors are able to identify what is their niche and be able to then highlight what exactly is an investment opportunity that agrees with them. So far, I think I don't want to give the data. On the National Health Insurance Fund, we have a total of 10.13 million registered members. Not all are active, maybe half are. The Linda Mama program, I don't think I want to, I'll share the presentation, but we have had a lot of improvement even in terms of the child mortality rate. We have reduced to a target, against a target of 7.2 to a number of about 7%. We have had other private initiatives, which, for example, the Beyond Zero campaigns have come in handy to help even in reducing health mortality. On the health insurance subsidy program, again, the numbers are magnificent. We have had a lot of improvement. The health insurance for the elderly was a new innovation, and which has also helped persons with severe disabilities, where government now has come in to actually take care for the medical needs of those special groups categories. The 6 referral hospitals, I think I may mention, we have Kenyatta National Hospital, the Moi Teaching and Referral Hospital, the National Spinal Injury Hospital, the Mathari National Technical Teaching and Referral Hospital for the mental health issues, Kenyatta University Teaching and Referral Hospital, which is actually a game changer in terms of the investments, especially on the cancer approach. They are really invested in equipment, so we are able to have what people would travel out there, having those services being offered here. We have Kenyatta National Hospital, again, it's the newest addition. We have now established radiotherapy centers at several hospitals, and we have 71 campuses of the Kenya Medical Training College. And of course, you had the discussion about MES. The Medical Equipment Services was a public-private partnership project, which was very successful, I must say, and which has given us many learning lessons. It is good to look at things positively. There are many lessons to take home from the MES program. I want now to mention the investments opportunities towards realization of Vision 2030. We have 8 years to go, and I want to start with that public-private partnership. Public-private partnerships in Kenya has not really been very lucrative. I think the gentleman from Ethiopia stated that this is not health in itself, is not a theme in life that is profit-making. And that in itself hinders. So you would find from our perspective that many investors would want to come and do public-private partnerships on other high profit margin recouping investments. For example, they would want to do energy, they would want to do infrastructure, they would want to do roads, they would want to do housing. And so the interest in terms of contributing to the healthcare agenda is not really very inviting to the public-private partners. So what do we need to do? Probably we need to incentivate as a government, and therefore maybe in terms of policy, amending and rectifying what are the discouraging clauses in our public partnership regulations and laws. Probably also, maybe we may need to also do the costings properly so that then government invests more so that there is also some slight profit margin for the investor. But government policy really comes out big in terms of providing incentives for the private sector. There are innovations that can be done in health. For example, in terms of what Varian has just presented, you saw that we are still reeling in terms of access to facilities. For example, radiology. For you, the time taken, the lead time taken between the time probably you're diagnosed with a specific type of a cancer, and by the time you get a facility give you radiotherapy, it is too long. Why? Because we do not have enough equipment. We do not have enough facilities providing. And therefore, these are areas that even if you're just a private investor, you would come in. Government now has really eased the ease of doing business program under BRS. You can easily come and invest in that particular health equipment and put it there so that then Kenyans are able to actually just access and reduce the time taken. There are also issues surrounding new innovations. For example, the vaccines. There are opportunities where, for example, you had during the COVID season, there are entities that were coming up with new vaccines, and these were new innovations. We have a lot of knowledge that is coming out of universities and a lot of research that is going on in our institutions, and even Kenya, Kemri themselves, they've done research. Already we have an entity that is working on producing vaccines. And I think in terms of vaccine sourcing, we are still importing a lot of vaccines. So there's a lot of opportunity for those who can prepare and make vaccines locally, or those who make abroad or outside there, and they can come here and invest their centers, which will also help us economically by creating employment. There is need for us investing in the human resource sector by providing medical institutions. We find that a lot of medical institutions in this country are government driven. For example, the major one is the Kenya Medical Training Institute. And compared to the universities that have medical schools, the Kenya Medical Training College has a widespread. It trains a lot of healthcare workers. Yet, if we were able to also have investors come on board and establish institutions that can train, would have more people getting trained on the health matters, and then provide enough personnel to work in our hospitals, because we are still having a challenge. On medical tourism, medical tourism has not been exploited fully, yet it is a great opportunity for investment. According to the Economic Development in Africa report in 2017, Kenya was named as a top beneficiary destination of cross-border travel for medical purposes. And it is true because in sub-Saharan Africa, we are second to South Africa. We are having people travel from other countries to just come and seek medical attention in our country. Either in our private hospitals, we have had occasion to just receive uh, even dignitaries from other countries just because our medical facilities are at another level. So this is an opportunity that we can easily exploit. Already, I know that we are doing very well, and this is not a political statement. In East Africa, we have medical tourism even for the most basic facilities, for example, including maternity provision. We have Ugandans and Tanzanians coming to Kenya so that they are able to get high-level health service in our sectors, because the private hospitals in this country have invested greatly in the health and wellness facilities. So for those who feel they want to get another touch that is at the next level, they come to Kenya. So tourism is a major issue that we can focus on. There are still opportunities, and I think the last speaker mentioned about financing institutions, focusing on insurance. A lot of Kenyans now are appreciating the need to have medical insurance, and as more awareness is created that you're not securing yourself and demystifying the stereotypes that if you insure your life, you're likely to die sooner than, if we are able to demystify that kind of stereotypes, then it is going to be possible for health investors in the insurance sector to sell more and make money, and it will still be profitable, even if we said health is not very profitable. In terms of health infrastructure, I think this remains a big investment opportunity. We had the MES project, which was a starter, but there's need for health infrastructure at the national level and at the county level, which can be, as per the question that we were being asked in the morning, approached through different ways. You can list the property, you can also come have that PPP forum, but you also can also sell. I know counties have actually invested, and looking forward, there are opportunities for selling. I know Kenyatta University Hospital, the newest, has invested in buying, and I know they have one equipment they're buying, which is very expensive. It's called the cancer knife. You can Google later. Yes, and I'm thinking that those are investment opportunities that we have. I want to mention briefly a few challenges on the health investment journey. Low realization of e-health, that e-health has not been localized. In terms of accessing services, health services electronically using technology, still, as much as now people have learned to use information on WhatsApp, on share videos, there is little that has been done that is very specific on health matters, and which I think is a good opportunity for us to raise awareness. We have had skewed distribution of health facilities. That is a bottleneck that has been given recommendations on how to propose. And we have had capacity challenges in terms of shortages of staff, and basically facilitation in terms of equipment to work in hospitals. And lastly, the lengthy process in the approval for PPP projects. So going forward, I think there is a lot of opportunity for investors to invest under those six thematic issues that we have highlighted. You can come in and bring out your issue, and the country is going to support you. Asanteni sana.
So thank you so much for those remarks. So at this particular point, I'd like to introduce a gentleman who has over 3 decades of experience in the health system.